Well, good morning, everyone, and welcome to the Physicians for Human Rights National Student Conference. My name is Dr. Holly Atkinson. I'm clinical professor and medical student advisor at the CUNY School of Medicine, faculty advisor to the CUNY PHR student chapter, and past chair of the board of directors of Physicians for Human Rights. All of us at the CUNY School of Medicine are so delighted to be able to host this conference. Of course, we just wish we could be all together and do it in person. I want to start by saying that PHR is an extraordinary organization, and I am deeply appreciative of the critical work that PHR does to protect and promote human rights around the globe, providing us with both a source of inspiration and a basis for hope. I also want to say that I am personally profoundly grateful for the role that PHR has played in molding my own career. Being involved in PHR has been a gift beyond measure. And I urge all of you students to stay involved with the organization. First of all, it's going to transform your lives. And second, we need your help in transforming the world around us. Now, I think this is a time where we need to expand our commitment to human rights even more than we have in the past. And it's our intent that this conference serves to deepen our collective human rights knowledge and also makes us better advocates to advocate for the vulnerable populations around the world and of course right here at home. And now it gives me great pleasure to introduce two of our second year medical students at CUNY, Jackie Liu and Sebastian Hochtovich. They are co-presidents of our CUNY PHR student chapter, and they have been co-chairs of the conference committee of the PHR Student Advisory Board. Thank you, Jackie and Sebastian, for your outstanding leadership and all the hard work that you've done to put this conference together. Jackie, over to you.
Thank you so much, Dr. Atkinson, for the introduction. Obviously, this conference would not be possible without you mentoring us, so thank you so much for all the guidance over the years, not just this year, for helping us grow into the advocates and medical students we are today. And so the first slide I want to talk about, everybody, good morning, is who is with us today. So, there were 449 total tickets sold last time I checked, and, I'm sure some people have signed up since I checked, so that number might actually be a little bit higher today. And, here at CUNY, we are so proud of this turnout. And I'm sure people trickle in during the day as well, because, our biggest hope for this conference is for people to come here, network, be able to speak to our amazing speakers and leave with a clearer vision of what it means to be a student advocate or a human rights advocate in today's society, when there are so many different events going on that clearly deserve our attention. So who is with us today? Well, of these 449 total tickets, most of them are students. 88% of our sold tickets were for student tickets. 6% were for other healthcare professionals, and 5% were for faculty or physicians. Now, amongst these 449 tickets, there were 4 high schools. There were, many undergraduate students, there were graduate students, and of course there were professionals as well. So I know yesterday we were a little bit surprised that there were high school students attending the session, but we have not just 1, but 4 high schoolers and high school students signed up. And I hope that they will share the link with other students today after seeing our sessions yesterday. We have undergraduate students, and they're not just pre-health students, which we really wanted to cater this not just to the medical sphere, but to other people who can play different roles in the human rights fight today. So these would include engineering students, someone who's studying neuroscience, and clinical psychology students as well. So thank you so much, everybody who signed up and has taken an interest in this conference. In terms of graduate students, we have medical students. Clearly, many of us are medical students. We also have people that are in public health, that are looking to work in social work, that are looking to get their PhDs, and their masters in science, and also PAs. And all of us play such different but important roles not only in the medical sphere, but when it comes to human rights, it's important that we have so many different fields of people advocating for those that we fight for. So we're very proud of that turnout. And finally, professionals, we have educators, we have people working in biostats, we have nurses, pharmacy people, advocates, and obviously physicians, and there are many more. These are just some of the ones I saw on the list. So thank you so much, everybody, for coming out and supporting us. And finally, I just wanted to say that, amongst these 450 people, there's a lot of variety in where we are from. There are 108 different schools and organizations represented today, and that's amazing. That's surpassing all of our wildest dreams here at CUNY. And there were 10 countries involved. So I know some people will trickle in later today because we had such a wide range of people from Australia, from Hungary, from Israel, Saudi Arabia. And from the bottom of my heart, thank you so much, because that blew my mind when I saw that all these people, from the UK as well. I didn't put it on there, but they came out to support us yesterday. And finally, on my part, there are just some logistical things. So first, I would like to ask that everybody has the most up-to-date version of Zoom. We have troubleshooted several problems that we had before, but we are very confident about having the necessary resources and backup today. And it is important to have the most up-to-date version of Zoom to use the breakout room function that we need. Secondly, please keep your microphones muted. And during these speaker sessions, we really love for our speakers to go uninterrupted and put any questions that you have into the chat box. And our team here at CUNY will be monitoring this chat box, and we will give you a time and space for those questions to be asked later on.
Thank you, Jackie, for the introduction. I just wanted to mention for everybody to please follow us on all of our social media. The PHR Student Advisory Board maintains several social media accounts, and it's how you can stay up to date on everything that we work on, future conferences. You can sign up for our mailing list and a mailing list to learn about our asylum network as well. So please do so. I also just want to, once again, plug our donation and raffle. Of course, this is the first time that we're having a virtual conference for obvious reasons. And for that reason, it's being offered at completely zero cost. But we have some costs to cover. And so any donations would be very, very much appreciated. For the medical students, we have set up a virtual raffle as an incentive. So you can find the information on this slide. I could also put it in the chat box. And we would appreciate any donation to support the PHR Student Advisory Board. And finally, I want to say some thank yous to some really amazing people that have helped us to plan this conference in the last several months. So at the CUNY School of Medicine, our faculty, of course, Dr. Holly Atkinson, who you all just met, who has just been such a wonderful mentor and guide to us, not just since we started medical school, but actually because we are a 7-year program, since the very first day of starting college. She's been our advisor, and she's been there for us, and she has just been an incredible influence and mentor and an inspiration to all of us. And we're so happy that we get to conclude this year hosting this conference with Dr. Atkinson. And of course, I want to thank our amazing Dean of Student Affairs, Dean Macbeth, who has just been incredibly, incredibly generous with his time and with just everything. And yeah, thank you, Dean Macbeth, and thank you for dealing with my countless annoying emails. We really, really appreciate it. And of course, the dean of our school, Erica Friedman, for always just having our backs, and Omer for his technical expertise, and our entire CSOM PHR team. And you all deserve to be recognized by name, so I'm just going to say your names: Yathika, Naushin, Hadi, Sheila, Mike, Olu, Nick, Chelsea, and Dylan. These are all actually undergraduate students at the moment. They have not yet started medical school, so I'm so excited for your future in PHR when you enter medical school. And to the entire PHR Student Advisory Board, of course, but a special thank you to Mike and Michelle, who are our co-directors of the Student Advisory Board. You guys have done an incredible, incredible job, and I'm just amazed at how you've been able to run everything. And a special thank you also to Arvind for just always being available and doing an amazing job in the media, and just like you respond to all of our messages in like 0.5 seconds. And to Rebecca also for all of your help and for just always being so passionate about everything that you work on. And of course, the entire PHR team, but a special thank you to Susannah, who has worked with all of us directly with the students, and has just been a really, really incredible link to the National PHR organization, and just an incredible inspiration to all of us. So thank you to everyone here. And yeah, we're going to get to this part later. So I'm going to pass it back now to Susannah.
Thanks, Sebastian.
Yeah.
Actually, it gives me great pleasure to be able to introduce Susannah to you, Susannah Sirkin. She is Director of Policy and a Senior Advisor at Physicians for Human Rights, where she oversees PHR's policy engagement, including with the United Nations, domestic and international justice systems, and human rights coalitions. Susannah has been with PHR for almost 34 years. She is one of the great human rights leaders of our time. And I have to say, Susannah, I have been so honored to work with you over the years. You've just been an extraordinary teacher to me and an inspiration. And it's just wonderful to be able to share this conference with you today. So welcome, Susannah.
Well, Holly, I have been inspired by you, and I'm incredibly inspired by the students. And I know that's going to continue throughout the day and beyond. So thank you so very much. I'm truly, truly honored and delighted to be here as, along with Dr. Katie Peeler, who spoke last night. This is always my very favorite time and event in our year, and it really grows every year into an extraordinary, inspiring day, and it inspires me to continue this work. And I hope it will. I know it will for all of you. I believe we're going to screen the film first, and then I'm going to say a few words. Is that okay? We have a little video. This was made about 1.5 years ago, and I'm going to, with my remarks, update it a bit. So if you'll bear with us, this is to give you an overview of who is PHR in case you didn't know yet.
Give me 1 second, everybody.
No while we're doing that, just a huge shout out to the CUNY deans and faculty, Dean Macbeth, Dean Friedman, Omer, and also to everyone who submitted a poster and presented it last night. Let's give a huge applause for those posters. And here we go. I think those posters were amazing.
So if this doesn't play normally, please let me know, but hopefully it'll be okay.
Looks like
49 doctors killed, 14.
New restrictions create a greater barrier to refugees. The data shows
many have been tortured, still suffer physical and psychological.
the Physicians for Human Rights doc.
Sorry, you can't hear it now, right?
Sorry, 1 second.
We could hear.
A little slow, Sebastian.
Did the use of chemical weapons. This is truly despicable.
They constitute crimes against humanity.
When doctors are trained not only to heal, but to use their expertise to document evidence of a crime, meaningful change can happen and survivors can find justice.
At Physicians for Human Rights, we investigate and document irrefutable evidence of human rights abuses using the powerful lens of science and medicine. A doctor's testimony is a highly credible scientific voice.
There was a mark on the left.
Okay. We know that through evidence, change is possible.
Following the mass slaughter in Bosnia, forensic evidence we gathered directly contributed to the conviction of Bosnian Serb leaders for crimes against humanity.
The prosecution imposes a sentence of life imprisonment.
No world leader, no government is above the law.
We at Physicians for Human Rights would call for the new Congress to meaningfully review the policies related to border enforcement.
More than 100,000 people seek safe haven in the United States each year. Many are survivors of torture, trafficking, and other forms of persecution.
I'm here with Physicians for Human Rights along the U.S.-Mexico border.
When a member of PHR's asylum network provides an evaluation that corroborates an immigrant's story, their chance at gaining asylum improves significantly.
Every year, countless numbers of women, men, and children endure brutal violence in areas of armed conflict. In the Democratic Republic of Congo, dozens of girls, some as young as 18 months old, were raped during a 3-year reign of terror in the village of Kavumu. In a landmark case at the end of 2017, based on crucial forensic evidence provided by local medical and legal professionals trained by PHR, a military court sentenced the perpetrators to life in prison.
If you struggle and continue struggling, you will always win.
We speak out and bring facts to light.
It has made it more than
Physicians for Human Rights.
Our experts provide training to our partners to help document sexual violence, torture, and mass atrocities.
How can we build accountability if we are missing adequate evidence?
PHR brings partners together around the world: doctors, nurses, lawyers, police, prosecutors, and judges to enable convictions for these horrific crimes.
Physicians for Human Rights was one of the first groups in the world to prove that Saddam really had used sarin and mustard gas.
PHR has exposed the use of chemical weapons and documented direct attacks on medical workers who provide treatment to those in conflict zones. Many of the physicians and nurses we work with are also persecuted, and some risk their lives speaking out about the atrocities they see firsthand. So we work hard to protect them. We also work closely with survivors who've suffered unimaginable physical and psychological trauma to ensure the support they need throughout the justice process.
Since our work began in 1986, we've made landmark contributions to the movement for human rights. Our epidemiological investigation in Cambodia in the early 90s helped to generate the political will to create an international treaty to ban landmines.
For that, we shared the Nobel Peace Prize.
Physicians for Human Rights will keep innovating
and will continue to bring critical and credible evidence to the pursuit of justice and dignity. Through evidence, change
is possible.
Thank you so much for screening that. This is a time like no other in the field of medicine, public health. The teaching and promotion of science and advocacy for human rights has never been more urgent globally. Since this film was made a little over a year ago, there has been a pandemic that we were egregiously unprepared for, which exposed gaping holes in the public health system, underscored vast inequalities of race, economic status, geography, threatened frontline health workers, including nurses, doctors, hospital employees, meat packers, migrants, detainees, nursing home residents, and those who have actually been victims of disinformation and insidious science deniers. Lockdowns have ground education and economies to a halt, and now we're facing enormous burnout among employees in the health professions, as well as mental distress all over the world. And then in the spring, the police killing of George Floyd reignited what is considered to be the largest protest movement in US history, with more than 25 million Americans out in the streets as of July, and many more around the world and since then. And this has happened right during your prime time of training to enter the professions of health and science, where you and your loved ones, as well as patients, are also struggling with unprecedented constraints and restrictions. Last week, a student in a human rights class at Hunter College asked me whether it was appropriate for doctors to be political. To answer such a question, which I get often, and many of us at PHR do, and I'm sure you have and will, I always think of the great Dr. H. Jack Geiger, a PHR founder and a CUNY professor emeritus, who is a monumental medical leader of human rights and civil rights movements for all the 9 decades and counting of his life. He started as a teenager when he moved from Brooklyn to Harlem at age 16. And Jack regularly quoted the great pathologist of the 19th century, Rudolf Virchow, when asked that question. Because Professor Virchow, the great pathologist who also investigated the typhus epidemic in Germany, and who lived from 1821 to 1902, and is considered to be a founder or the founder of public health, he said notably, medicine is a social science, and politics is nothing else but medicine on a large scale. And he added, if medicine is to fulfill her great task, and I love that he called medicine a woman, but then she must enter the political and social life. The physicians are the natural attorneys for the poor, and the social problems should largely be solved by them. Now that's a tall order for all of you and for Physicians for Human Rights. Jack Geiger has said that his life's effort has been to, quote, fuse human rights and social justice activism with the skills and perspective of the medical profession. So here we are today, and this is the task, and you are the future. Last week at PHR, online, obviously, because we're all working from home, Lancet editor Richard Horton gave a talk to PHR leaders and supporters. And he said that he is incredibly optimistic about the future of medicine and health and the globe. He was very excited about a forthcoming vaccine that should be, and we hope will be, safe, effective, trusted, and most importantly, shared globally with equity. He was very excited about the opening of science and the unique, unprecedented collaboration across schools, institutions, continents, and organizations and states. And there again, we have to struggle to make sure there's transparency as we go forward, and that all share in the benefits of science, which is a human right. But he was also excited about extraordinary collaboration, community created in the health professions, and solidarity, both at the community level and in the medical and public health communities, that he has never seen before. So after we made this film, a few months later, with the pandemic, with Black Lives Matter movement and the campaign against racial injustice, PHR pivoted. We've been hosting weekly webinars, which you can find on our website. I think we're up to more than 30 of them now since April. We have worked intensively on the border and with asylum, which we'll hear a lot about in this conference today. The asylum work of PHR has quadrupled in the last couple of years, and especially in the past year, as the Trump administration cracked down horrifically on the right to asylum. We have worked on excessive force by police and security forces, by sending also a team right at the height of the pandemic to Portland, Oregon to document attacks on protesters, including on medics. We have worked on the protection of healthcare workers, and we'll have a whole panel on that later today. Not only those who have been attacked because they haven't been able to provide medical care or because they're thought to be carriers of the infection, but also those who have been attacked in war, as PHR has been working on for years. And right now we have launched what we're calling a campaign to support science, but also a mask mandate campaign more specifically. And I'll leave you with this slide as I give a huge shout out to Sebastian and Jackie and all of the incredible students at CUNY who have organized this conference together with the support of PHR Student Advisory Board. I really look forward to being with you. This is the campaign we're working on, and we couldn't do any of this work at PHR without the incredible support and boost that we get every single day from our board of directors. And I'm just truly thrilled and honored to introduce you to the chair of our board, Alan Jones, affectionately known to all of us as AJ, who is going to close this welcoming session with a message from the leadership of our organization. AJ has brought us energy and confidence and optimism and a lot of humor, which we know that he always sprinkles his remarks with, to understand for all of us that we really can't be healthy without some humor every day in our lives. But also we all can't be healthy without gratitude. And I want to share my gratitude to all of you as we start this day. Welcome, AJ, and thanks for being with us. You're such a stalwart supporter of the student program at PHR.